Madeline Leininger was born in small-town Sutton, Nebraska in 1924. She was raised on a farm with 4 brothers and a sister. She earned her diploma as a nurse from St. Anthony School of Nursing in Denver, Colorado. 2 years later, she achieved a Bachelor of Science degree in Biologic Science from Benedictine College in Atchison, Kansas. She continued her education at Catholic University in Washington, D.C., and eventually received her Ph.D. in anthropology from the University of Washington in Seattle in 1965. Madeline Leininger's nursing experience allowed her to achieve the ranks of the most respected in the field of nursing. She became a faculty member at the University of Cincinnati and at the University of Colorado. She was a nursing school dean at the University of Washington and the University of Utah. She was a professor of nursing at Wayne State University and was an adjunct faculty member at the University of Nebraska Medical Center. Throughout her life, Madeline Leininger observed several cultures and realized that their needs are different. She used her experiences and her anthropology degree to develop the culture theory, which was termed transcultural nursing. In her book, she defines transcultural nursing as a discipline of study and practice focused on comparative culture care differences and similarities among and between cultures in order to assist human beings to attain and maintain meaningful and therapeutic healthcare practices that are culturally based. Some of the ways that nurses use culture every day are that we plan our care based on cultural differences. We make decisions about care using the culture theory and consider the care that will be delivered. This is an example of the sunrise model developed by Madeline Leininger. Use of the sunrise model guides the assessment of cultural data for an understanding of its influences on the patient's life. The nurse plans care, recognizing the health benefits and folk practices of the patient's culture, as well as the culture of traditional health services. The outcome is culturally congruent nursing care. The relevance to our practice speaks to the key aspects of the American Nurses Association. Provision 8.2 states that in providing care, the nurse should avoid imposition of the nurse's own cultural values upon others. The nurse should affirm human dignity and show respect for the values and practices associated with different cultures and use approaches to care that reflect awareness and sensitivity. As nurses who work in a large university-based surgical center, we care of patients from a wide variety of cultural backgrounds. We must be prepared to accommodate differences in cultural norms and expectations, in addition to the more obvious language differences. As of 2010, 38% of the U.S. population identified as ethnic or racial minority. This number is expected to increase by 50% by the year 2015. Research illustrates that healthcare disparities exist among ethnic and racial minorities. With these changing demographics, Madeline Leininger's theory of cultural care is more relevant today than it was when she developed it in the 1960s. Leininger described the nurse who has achieved this competency as being able to creatively use the client's beliefs, values, and patterns along with appropriate professional knowledge and skills that meet clients' needs. In conclusion, we live in an increasingly diverse community. It is essential for nurses to provide competent cultural care. Cultural assessment should be part of the overall patient assessment. According to Leininger, this begins with an open learning attitude in mind with a sincere desire to learn as much as possible about cultures that are not our own.